This video is going to be as comprehensive as I can about acne scarring in 2023. If you watch any of my older videos from 5 years ago or 10 years ago or even 2 years ago, I've constantly tried to evolve my thinking, and hopefully this will be a very good comprehensive evaluation or thinking about acne scars. So the first thing with acne scars, I want to sort of have you understand how I mentally conceptualize them. Most people that look at acne scars, what they look at is they want to sand down all of the normal skin to get down to the abnormal skin, which I don't think is possible. So I look at elevating the abnormal skin to reach the normal skin with some exceptions and some finesse points that I will address during this video. So that's a broad sweeping understanding. So acne scars, for the most part, fall into the category of what's known as atrophic scars. The opposite of an atrophic scar would be a hypertrophic scar or a keloid. And if you want to learn more about what those scars are, I have a whole video called Hypertrophic Scar versus Keloids. But hypertrophic scars and keloids sit above the normal skin. Atrophic scars sit below the normal skin, and atrophic scars are generally what acne scars are all about. There are some other components to that I will finesse and talk about in this video, but in general, that's a very broad conceptualization. So what we want to do is take, if this is normal skin, we want to take that atrophic scar to come up to here. Why don't I do what everyone else does, which is lasering it down, dermabraning it down, doing all these fancy moves to get it down? The reason is that I don't believe you can take that normal skin low enough to fix the abnormal skin, and I think it's not a very effective solution. I think the best answer is to raise that abnormal skin up. So in terms of how I do it, I divide the types of scars not into boxcar or ice pick scars, although those are potentially helpful categorizations. I look at it based on the size of the scars. Are they very small? Are they medium or large? Now, what does medium and large even mean? So very small would be the size of a pore, of someone's pores. The texture looks off. Medium ones are a little bit bigger. They're going to be maybe the size of half of a pea, if you will. And then a large scar would be anything maybe a size of a pea beyond, maybe a pea versus multiple peas put together. So that is a broad categorization. Each of those categories and sizes requires, for me, a different type of therapy with some level of overlap, which I'll sort of explain here. So we're going to start with the small ones first, the textural ones and things like that. So I use Botox for that. Now, you can listen to my other videos where I talk about all the various uses I use for Botox, including acne scarring, but this is a subcategory of how I manage acne scarring. I know what you're thinking. Botox is unsafe, and Botox is going to be some temporary phenomenon. Botox is going to paralyze my muscle. But Botox actually provides profound long-term solutions toward acne scars, but one specific type. It manages active acne, and it manages acne scarring. And if I forget to mention this, if you're on Accutane, I can do any of the therapies I'm about to mention to you and really not have too much risk, in my opinion, but I will make some qualifications about that as well. So how does it manage scarring? How does it manage pores? How does it manage active acne? Here's the problem. I don't 100% know. I cannot tell you exactly how it does it. It just does do that. So Botox, how do I do it? I use what's called Mesobotox, and you can watch a 25-minute video where I detail what that is on Mesobotox, but that's way beyond what I need to talk about in this video. Suffice it to say, I've been doing it for over a decade, and I've gotten incredible results on active acne and minor scarring. So if you come in, you've got textural irregularities, you've got pores that are enlarged, you've got active acne, you've got discolorations to your skin. All of those components, even mild degree of scarring, can be easily corrected with Mesobotox treatments. So is there a recovery involved? Not really. They're in about a percentage of patients that could be anywhere from 5% to 50% of my patients. When they smile, their smile is a little bit less full for about 6 weeks. I've had a couple patients last for 2 to 3 months, but usually there's not much bruising. It's a very easy treatment. I use numbing cream first just to make it a little bit more pleasant. It takes me about 5 minutes to do it, and you should see results within a few weeks. And so it's something very powerful. If someone has the budget and we're dealing with actually active acne and scarring, I usually recommend to do that procedure every 3 months for the first year. After that, most patients do very well with much longer categories of time, 6 months, 1 year. Sometimes they skip even several years. Once I get everything controlled, you need less and less treatment. Now, if it's active acne I'm treating, not just the scarring, but active acne, sometimes we've got to do it once a year or every 6 months, or if you're really bad off, every 3 to 4 months, which is usually not the case. If I'm dealing with just types of scarring, oftentimes we can start getting longer and longer therapies where hopefully I'm not doing it more than once or twice every year or every other year. So it's something that's very, very durable, where even if you skipped hopefully 2 to 4 years, you still look better. Remember, skin overturns every 30 days, and Botox, even though it's incredibly long lasting, there can be some recurrence and need for more therapies. But in general, my goal is not a short lasting therapy, but long term. Discolorations such as redness, brown discoloration, quality of skin that may be related to the acne or acne scarring can be improved. It takes longer to see the difference. It oftentimes does not occur with a single treatment. But Botox for acne and acne scarring is typically, remember, for pores, texture, tone, minor textural problems that I simply can't address with my other therapies. And to me, it's a great adjunct. At the end of the video, I'll talk about sort of an interval of therapy that may be advisable. But that's one thing I would recommend for you. I also use Botox for over-sweating in the face. I use it for quality of skin, just in people that come to me. But I'm talking specifically for active acne and acne scarring. And the other 2 therapies I'll mention do not work on active acne. So that's one therapy that I would recommend if you have those issues. Let's talk about medium scars. So medium scars, to me, I say a half a pea size, but even a half a pea size can be managed, can be thought of as sort of a larger category. Depends on a gestalt. Another gestalt of how I see you. In other words, when I just look at you, I have a visualization of what I would recommend. But the other category is sort of a larger textural problem, and that may be a category of ice picks, box scar, that are sort of etches in the skin that are a little bit bigger. So I think half a pea would be too large. Half a pea probably would still be a category of large. I would say maybe on the order of, if I'm talking about a pinhead, something like the tip of this rounded pen, that it looks, or maybe just something on the order of, I hate to say, like this, just at the tip here, which looks sort of etchy. Like the skin is like a little bit scarred and bigger etching than what I can treat with Botox. Although Botox will help somewhat, it's not as good for sort of medium scars. So medium scars would be these etch marks that are in the skin. My treatment for that is radiofrequency microneedle. RF microneedle is very different from microneedle itself. Handheld microneedles, to me, do very, very little. You're not going to see much gain with microneedle. Radiofrequency microneedle works incredibly well. There are many different brands of RF microneedle, and I don't think it matters as much on the brand, but the RF microneedle is not done by me, it's done by my staff. I do the big and the smalls, I don't do the mediums, because the microneedle I have seals down on the skin, it locks in with a vacuum, so the needles engage, and then the RF frequency is delivered to the dermal level, and it helps create a little bit of collagen remodeling in that area. I do that once a month, and I do that basically once a month for about 5 to 15 rounds. In the past, I would say you needed 5 or 10 rounds. I'm now really saying you need 10 to 15 rounds, and you may even need a few rounds before you even see a difference. The recovery of the face is, so the procedure is done with numbing cream, and there's a little bit more discomfort. If someone has more discomfort than they need, I can give them Pronox, which is a breathable nitrous gas. Most people don't need that, but you don't see any difference for a while. This is not like Botox, where oftentimes with 1 round you're seeing a difference. Remember what I said, that in terms of multiple rounds of therapy to get some of the ultimate results with Botox, but some of pores, texture, quality skin is pretty quick. In terms of the RF microneedle treatments, don't expect a difference until you've seen at least, I would say, 5 rounds. And oftentimes 5 rounds is not enough. So it's a much more delayed response. Recovery is a little bit more. Let me explain what that means. there's little tiny dots that are visible for a few days to a week. And so for men, it's harder because they don't put makeup on. Usually the makeup that is on the skin covers pretty well. A makeup my wife found when I was doing a type of filler for her is something called Dermacol, Dermacol. I don't think they have it for African American skin, but it is something that you can get it on Amazon Prime. It covers pretty well. So I would recommend this product. It's not expensive, and it definitely covers pretty well. I have no financial affiliation with the company. One other thing I wanted to mention, if I forget to mention this, is that the 3 therapies I'm talking about, from small, medium, and large therapies, are all safe with all skin types. So if you are dark skin African American all the way to light skin Irish, generally this is really safe. I'm not lasering you, and that's one of the huge benefits, is that it's safe in Fitzpatrick 1s all the way to 5s. So let's continue with this. So with a therapy, if you have good makeup, usually it takes that 5 to 7 day of little dots down to a very short time, hopefully not even much recovery at all. But without makeup, you're going to see little dots in your skin for a few days, and that's your biggest recovery. And remember, as I said, you're not going to see the results for a little while, so it needs time to see that difference. The one that I've been doing for 20 years with microsilicone injections, that is to treat medium or to large scars, and very, very effective. With silicone, I use FDA-approved products. People ask, is it FDA cleared? So I want you to understand one thing. It's off-label. So what off-label means is that it's perfectly legal for me to use the product. So as long as I consent you on the product, I have you understand what it is. I use Silicone 1000, Silicon 1000, which is from Alcon out of Fort Worth. I've been using it for 20 years. I train with the doctor, has done it for 50 years. And he's trained with the doctor, has done it for that long as well. So before the introduction in the mid-90s of Silicone 1000, there was another product by DuPont, which was also FDA cleared. There was a window of time there wasn't something, and I do everything by the letter of the law. It is absolutely legal for me to use silicone, and I have a very high safety profile with it. So I'll sort of talk to you about this and have you understand it more. First of all, what is the legality? Absolutely legal for me to use it in a way that's safe. And I have to discuss with you that. So people understand when they look at silicone, they hear things like granuloma. Granuloma is a chronic infection of a product. I've never had that, but understand that what you want to make a distinction between is pure medical grade product drawn very sterilely and injected, which is Silicone 1000, versus these illegal therapies being performed by unlicensed individuals injecting it into the butt. Large volume adulterated product is very dangerous for the body. So that's one thing you have to understand. Silicone also, people worry about, some kind of autoimmune disease, things like that. And I will tell you, silicone is, if you don't know this, is coated on every single needle out there. It is something that is, it is on, if you have had Botox injections, if you've had a vaccine, if you've had anything that has a needle, you have had silicone in your body. If you use a knife, every knife is coated with silicone, almost every single knife that is coated with silicone. So small doses of silicone can be very safe for you and not a problem. Large volumes of silicone are not safe, especially when they're adulterated. Now, one area that I correct a lot of silicone is in the lips. Usually it's because it's unlicensed professionals using silicone in the lips, but I believe silicone in the lips is not a very good option because it's inherently problematic in the lips. People bite their lips. There can cause a little change to the lips over time. And if you want to listen to how I fix silicone in the lips, there's a whole other video where I've got multiple ones about that. But that's an area that I don't do silicone. I don't think it's safe. I don't use silicone in large volumes. I know some of my colleagues believe that they can put a lot of silicone into the face. I don't do that. I'm using very, very small medical grade silicone injections into acne scars. In a moment, I'll tell you why I think silicone is a preferred therapy. It's not just it's not really permanence, which I need to clarify that and explain that to you more in a moment. But I believe silicone is an incredibly safe product in my hands. Have I had complications? Have I had granulomas, infections? No, never. So if you said, have you had any complications with silicone? Yes, I've had a couple patients, literally 2 to 3 patients that have had a few bumps. And he said, well, that must have been a granuloma. It's not. Silicone has to be placed exactly perfectly into a span of 2 to 3 millimeters into the dermal area. And if it's slightly higher or slightly lower, and I've done millions of these little injections, it could lead to a little visible bump. I've had a few patients with that. Believe it or not, those patients that I've seen that in, they've actually continued to be my patients because it's so easily correctable. How do you fix it? Very easy. I put numbing cream for 45 minutes, any little bump, I put a little hot tip cautery, zap, 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 done. A couple days of recovery, it's gone, and they're flat. So I had a lady recently, not recently, excuse me, a few years ago, that I did 2 rounds of silicone on. She went to New Jersey, had 1 round, and she had bumps all over her face. Now, was I scared that was some kind of granuloma? Could have been, but there was no infection, there was no tenderness, no problems. It was immediately after the injection, so I knew that what that was technical error. It was placed too superficially and it needed to be corrected. So what I did for her is I just did a hot tip cautery, flattened her out, gave her a little while to heal, and then came back and continued the therapies. So I find it to be very, very safe. So the question though is, why do I prefer silicone? The reason why I prefer silicone is that there is no product like it. Now, I told you, I cut on silicone every week on lips, and so I see the bad result. I look at the silicone. Silicone is not a liquid that pours out. It's integrated into the tissues very effectively. So why can't I use Restylane? Is Restylane because it's temporary? No. Actually, I've had a lady that I did Restylane on. Last time I did was 2010. The year that I'm shooting this right now is 2023. And she had an MRI in 2021, so 11 years after the last time I did her fillers, and the Restylane was still there. I did a lip correction on a lady that I cut on the lip for silicone, and Restylane squirted out of the lip, and I said, hey, you have Restylane here. This is potentially a temporary filler. Hey, do you have when did you get Restylane? She said, I never had Restylane, Dr. Lamb. Then she says, oh yes, in Europe in 1998, which was exactly 20 years prior, so I did the surgery in 2018, she said I had 1 syringe of Restylane. It was still there 20 years ago. Now, not all of it, just a little bit. But so Restylane, I don't perform in these areas, not because Restylane is short-lived, but because it fails and it becomes lumpy. And the reason is that what silicone does is I can actually stent that dermis slowly over time, and it doesn't become lumpy. It stays where it needs to be, and it doesn't become a accumulated mess. When you're putting Restylane in, you have to place it subcutaneously below the skin, and the more you place in, it becomes a lump. It becomes visible. If you place it intradermally, you're going to create Tyndall effect, which is a transparent clearness. Now, here's what's really cool about silicone. It is transparent, but you place it into the dermis, you don't see it. It doesn't become a Tyndall. It doesn't cause light refraction issues that you can see that are visible. So actually, let me take a step back and explain to you what layer I'm placing the silicone into. So silicone is placed intradermally. So the skin has epidermis, which is the outer coating, dermis, which is that just the thickness that you can feel is about 2 to 3 millimeters thick. It's the whitish portion that is comprised of 2 layers in there, papillary and reticular dermis, and then below that is the fat. So what I'm gliding over is the fat. Restylane is placed into the subdermal tissues, into the subcutaneous fat, and that's missing it. Okay, it's like the princess and the pea. It's like the pea is too far away from it. All you're going to create is bulk. You need to not create volume. You need to fix the etch. Now, if someone has got significant volume loss in their face, then yeah, fat grafting, fillers can, like Restylane, can help. Silicone, in my opinion, I don't believe it's safe for too large quantities of it. I'm using it in very finesse points just in the dermis, and it's a cumulative build. So I don't believe fat is great because fat is weight dependent. If weight changes, it can not be good. So I don't like fixing in just one little tiny hole. And fat is too soft. It's placed subdermally. So think of Restylane and fat as subdermal fillers. Now, Belafil, or previously Artifil, previously before that is Articol, I've done thousands of injections. I actually thrown $100,000 of that product away. It is not a good and safe product. I think that can lead to long-term granulomas and physical changes that are not good. And believe it, that's the one thing that's FDA cleared for acne scars, and I think it's a horrible product. Now, here's what's interesting with Artifil. It is also a subdermal filler. You do not place that intradermally. So there's no good intradermal filler that's out there. Silicone is the only product in my hands that works well. Now, silicone, as most people, it's a technical injection. It is very difficult to do well. I have done, literally probably millions of little passes of my hands for silicone. So I am very, very skilled at it, and it requires a skilled hand to do this. So is there a risk? Of course. Anything I do is a risk. Is it permanent? Yes. Can I get rid of it? I cannot. So you need to understand that. Have I needed to get rid of it over the 20 years? No, I haven't, except for that, what I told you about, just taking a couple bumps down and flattening, which is easy to do. So unfortunately, or fortunately, or however you want to look at it, there's no comparable filler to that. The other thing interesting with the silicone is that it's narrower than a red blood cell. So in terms of necrosis, infarction, it's practically impossible. I wouldn't say it's impossible, but it's practically impossible. That's why post-rhinoplasty, it's the best thing to manage micro irregularities, because it doesn't get intravascular. It stays where it needs to be, unlike Restylane, which can cause problems. So there's a lot of variable safety issue. Now with silicone, I don't like the numbing cream if possible. It doesn't hurt much because I do a lot of vibration to inject, but I found that that causes some distortion. So if you absolutely need it, I'll do it or give you Pronox, but I would say 98% of my patients don't do it because I need 100% accuracy with silicone. And in terms of when do you see the difference? Now, I always tell my patients at a week, things are slightly swollen. So don't look at it and say, oh my God, it looks perfect. You're not, that whatever you see that first week is hocus pocus. It's just some swelling. If you have it at a month, that's when I would say you're really seeing the results. And I've seen my patients now 20 years out from my therapy still holding really, really well. So people worry about how it's going to age for you. Because it's intradermal, even if your subcutaneous tissues are becoming flaccid, that silicone is moving with your dermis. I have found that it doesn't age poorly over 20 years. It stays really, really well. So of course, theoretically, any permanent filler may not age well for you, but this I have found over 20 years has aged very well for my patients. The other component with this is, what is recovery? So typically there's not a lot of bruising, and the reason why there's oftentimes not a lot of bruising with my Botox and my silicone injections, that these are at the dermal level. Now my microneedle is going to pass through the dermis a little bit, so there can be a little bit more micropunctate bruising. With my silicone and with my treatment using the Botox, it's intradermal. So where are the blood vessels? Blood vessels sit below the dermis. So because I'm intradermal for almost all my injections, there is very rarely major bruising with silicone. So there's not much recovery, maybe a little bumpiness for a day or two, maybe a little swelling. But generally speaking, there's not a ton of recovery for the vast majority of my patients that do silicone, just like my Botox patients. Except, as I mentioned with the Botox, sometimes for 6 weeks, there's a little bit of a smile restriction. So with silicone injections, the biggest negative with silicone that I repeat to patients every time they come in and do this procedure is that you're not going to see a difference for a while. And that's disappointing. But I tell my patients, please, try to do it at least, you're doing it every 28 to 32 days, but in other words, once a month. You're doing it every month slowly, and you really need about 3 to 4 rounds to begin to see the difference. So I want to underline that word begin. People hear the word 3 to 4 rounds, and they want to hear the best thing out of that, which means Dr. Lamb told me I only need 3 to 4 rounds. That's absolutely false. I used to say in my older videos 4 to 7 rounds, and I had one lady that really pushed me to do more and more, and I felt I wasn't hurting her. I said, okay, let's do it. And by the time I hit 15, 16 rounds, I was seeing insanely good results. And that was many years ago. So now my patients are doing on average between 8 to 15 rounds. That's a lot of rounds. And if you imagine that, if I'm doing it once a month, we're looking at a year and a half before we get to where we want to be. Does that mean that it takes a year and a half to see the difference? No. You get pretty good results. You don't see much. Then you start seeing, wow, 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 wow. I call it a slope. I call it a bell curve. Now, in my older diagrams of bell curves, they were centered around 3 or 4 rounds. I'm really now pushing that bell curve out. What does that bell curve mean? It means I don't see a result. I don't see a result. I see, oh, wait a second. Oh, I see more. And then I see less. So as you hit that downstroke of that, and everyone is different. It could be 7 to 8 rounds before you start downstroking. It could be 15 to 20 rounds. Whatever that downstroke is, when you start feeling like, hey, this is not worth my money, then stop doing it. Because honestly, I don't want to waste your money. But I'll tell you what's interesting with acne scars is that people are so interested in managing this that they will just continue doing it. And here's the truth. Unfortunately, even though acne scars are never going to go away, and that there's always going to be a certain lighting with overhead lighting, whether you're at a cathedral in Europe or on a beach out in Saint-Tropez that just says, man, my scars don't look as good. There's going to be, what my goal is to move is to move you from as many bad lighting situations to as few as possible. So the more you do, even though in most lighting situations, maybe it wasn't worth it. Maybe I could edge out those other lighting situations that just don't look as good. A story of a patient of mine from Virginia. She moved back there, and she told me every time she went into her family's bathroom, there was this one bathroom that made her cry. I mean, literally cry. And after I had finished like 8 to 12 rounds on her with silicone, she went back to her parents' place, and she didn't even cry. She was actually happy and elated. I mean, that's a beautiful story. So silicone is a very powerful therapy, but it takes me time to see it. So as you hit that bell curve up, if you start to go on the other side and you say, hey, this is not working as well, I really feel like I'm wasting my money, then stop. So understand, I just want to give you that advice. You stick with it. It's not that you have to wait 2 years to see a difference or wait a year. You need to start seeing that result. And I usually encourage patients financially, at least get me to the point where you're seeing some outcomes before you decide to pull off. If you just do 1 or 2 rounds and you say, I didn't see a difference, well, then I have wasted your money because you didn't invest the time to do it. So it's sort of like paying for a 2 months gym membership and saying, I'm going to go twice then. And you say, well, why did I spend $200 on this gym membership for a couple of months? I didn't see anything. Well, that would be accurate. You probably did not see a difference. And when would you feel great about your investment at a gym? When you've lost 5 or 10 pounds, your muscles better, your resting heart rate's better. If you see parameters that show that there's improvement. Now, one thing I'll warn you about is I take photographs every time you come in, but I don't like to review your photographs for at least 5 or 6 rounds of silicone. Does that mean that I'm trying to cheat you and hide things? No, because here's the problem with photography. Lighting, if it's that time of the month for you, if you have a little bit makeup or not makeup, if you have a little swelling from drinking too much alcohol, if your head is tilted slightly off and the angle is coming down differently on the lighting, if you are not in par with where my light is striking down, if the camera is picking up a little different of the color or the exposure value slightly differently, if it's metering off your nose versus your cheek, you may look better or worse. But the one thing I'm confident is efficacy and safety. But you've got to give me the time and understand that photos are not going to tell you all the truth in 2 to 3 rounds. It's so important you hear that. You've got to give me time. I'm not going to waste your money. I feel very confident in terms of safety and efficacy and my experience of having done this for 20 years. But that's something you need to know with silicone is you've got to give me time to get that result. Okay, so that's really, really important you hear that. So I want to talk briefly about sort of, how do you go about this? What would I advise? So here's what's interesting. Because the biggest recovery oftentimes is that middle RF microneedle treatment, if I don't feel that's the most beneficial for you, I may do a combination of Botox and silicone. Can I do those the same days? In the past, I would say we should split it. Now I'm pretty confident to do both the same day, but I've got to do the silicone first. I can't do the Botox first and then cause distortion, not read it. I've got to do the silicone first. So I could do both of them the same day. I could split those on different days if you want. But some of my patients, I do Botox every 3 months for a year and silicone every month, and they can be on the same day, can be overlapped however you want. But I don't like to do the Botox a day before and then you come back the next day for silicone in case there's mild swelling there and I can't read it. So in general, Botox doesn't cause really long-term swelling, but I wouldn't do silicone like a day after some other therapy. I definitely wouldn't do silicone a day after a microneedle because you can't figure out what's going on. So my patients that I advise are of microneedle and silicone. You can do it several ways. If it's mainly big problems, you could do the silicone first and go through a session of series and then start the microneedle to finesse the problems. Or you could do an alternating every 2 weeks where you're doing silicone every month and then RF microneedle every month, but you're staggering it so it's done every two weeks to do this over the long haul so that I can get you faster to the results. I sometimes recommend that to my patients who are trying to accelerate the therapy, but you don't want to do silicone every 2 weeks and microneedle every 2 weeks. That's too aggressive. You need to have some time for the collagen to wall off for each of those procedures. Some of my patients, the reason I don't recommend RF microneedle to start out with is I find that sometimes if we meet the small treatments and the big treatments from small Botox to large treatments of silicone, that they can bleed over to the midline where the middle structures are not as critical to work on, and sometimes that's the case. Now, I want to talk about other therapies. Dr. Lamb, do you use fill in the blank? Do you use Do you use a cross technique, which we'll talk about what that means? Do you use lasers? Do you use dermabrasion? That's what I've had done. And most of you hearing this video probably have failed all of these things. So believe it or not, I do some of these techniques and some I don't. I'll explain to you when I do and when I won't. So I'll tell you a story of a lady that I was treating with silicone, and then that's the other thing I want to talk to you about, is that silicone, people get so nervous that if I've had silicone, I can't do blank. I can't do fillers around it. I can't do Botox around it. No, you can. The only thing, because you have a permanent filler, I would love for your skin to be very well cleaned. And so that's why in my hands, I like everything to be cleaned very well. One thing I love to use to clean it with is something called either Surgery Heal Pro or Microsin, which is a hypochlorous acid. I have it here, medical grade. So if you're going to go get some spa treatments with deeper therapies outside of what I have, definitely use that to clean your skin. I prep all my patients with it. So here you're not going to have to worry because I do everything clean. And I've never had an infected silicone, but that's something that I will say. It's just good to get good prep work if you're going to do deep therapies elsewhere, but you can laser over silicone. Which brings me to the point of, do I do laser for these things? Now, I just told you that I don't like leveling good skin down to bad skin, but are there cases when I would use a laser, and what kind of laser would I use? So I use fractional CO2 lasers, in up to a Fitzpatrick 4, which means Hispanic, Asian. I don't do light skin black. I don't do light skin Indian. I think it's dangerous when you start to get to those levels. But I only do laser in a very small minority of my patients. I would say less than about 2% of my patients do I need it. Now, when would I do it? I do it at the very end of the day. At the very end of all these treatments. Now, why would I do it? So think of this. If I can get silicone, RF microneedle, Botox pretty good, but let's say it's a vertical scar, whether it's an ice pick scar or boxcar scar, and there's that little bit of that shelf left. That shelf edge I can't quite clean out with everything I've done, but there's still that little edge. That's when I come back and use a laser to finesse and blur that edge out. So if you've got a very hard, deep edge that comes down, I may be giving up on silicone sooner. Not giving up like it didn't work, but stopping it a little bit sooner and moving you to a laser. A lot of my patients don't need laser. I get such a good result with all these 3 therapies that most people don't even need the laser. And that's why it's also great, because I can appeal to all Fitzpatrick types, even dark Central African skin. But occasionally, I'll look at the very end of all those treatments and say, let's do a little laser to manage it. What are the treatments I don't do then? So I don't really do dermabrasion anymore. I can if it's one little area. I do dermabrasion, and dermabrasion should be distinguished from microdermabrasion, which are totally different. Dermabrasion is a sanding down process. I use dermabrasion all the time for mole removals, mole removal, scar revisions, little scars I don't like, but acne scars, it's a little too traumatic for a whole area, but I can do it if I find that edge is just not being treated with fractional CO2, but it's rare that I do it. So we're talking about a journey that ends at 1.5 years, 2 years. Then I could come back and do that little laser, but most people, I don't think I need to do that. And then I do cross treatments. Cross is spelled C-R-O-S-S, like the word. It's all capitalized. It stands for subcutaneous reconstruction of subcutaneous scars. It's using 100% or at least 50%, usually 100% trichloroacetic acid or TCA, and it's used to scar that atrophic scar back up. Believe it or not, I used to do that about a decade ago, and I had some success, but I also had problems. I had some areas where the scar got worse. So I don't like it. I really have now stopped it now because I got so many more reliable methods of doing it. So I've really stopped doing cross treatments. I think the risk outweighs the benefit, and it just takes too long to see the difference. And I've got so much safer ways to get things done that I feel like cross is now no longer a treatment. Do I do a undermining, like a release of the subcutaneous tissues, the tethering, using some kind of subcutaneous undermining techniques, or release of deep tissue scars? I don't. I find that there's higher risk for either problems or ineffectiveness. I've done in the past, I don't like it. You say, well, I've got a guy that's done that, and that is worth it. Fine. Everyone is different. ways to handle things. I'm not here to poo-poo it in the sense that, hey, this is the my way, the highway, but if you come to me, I'm going to tell you what works in my hands. And in terms of doing some kind of subcutaneous release of tissues, I don't like it. In fact, I had a lady a year ago that I had really good results with silicone, and then she decided to go get this treatment with a little bit of this undermining of the tissues with a needle, and she actually had worse scarring. I had to go back and fix it for her. She said, oh man, I'll never do that again. So I have no idea why she did that, because I was getting incredibly awesome results for her, and she messed it up. So I will tell you, a subcutaneous undermining of tissues, releasing of tissues is not a great therapy. I think there's risk and not great benefit. There's no reason to do it in my hands. Never say never. Maybe I'll shoot a video in 2026 and tell you it's the best thing in the world. As you hear, if you listen to my old videos from 5-10 years ago, I've evolved my thinking. So it's not I've contradicted my thinking, I've not gotten rid of everything, but I have really evolved it. So by being able to articulate this in 2023 and understand sort of where I currently am in the landscape of acne scar therapies may be helpful. There's a million things I could talk about this. I've shot now 35 minutes of video, and I have so much information. As I told you, just the Botox alone, I've shot a 25-minute video just on that, and I can't bore you with that because there's enough information for you there. Suffice it to say that I do great acne scar treatments. I have patients that have failed everything, that I've spent $15,000, $20,000 somewhere else and are tired, and I really can help them. So understand that the hardest thing, though, because it's a long investment with multiple rounds, it's very hard for me to do people outside of Dallas-Fort Worth. But if you're willing to make that commitment to me, and you have to give me that time, I'm very confident I can help you in a very safe, effective way.